Good morning, everyone. Welcome to June's Community Cafe. We had a couple more people registered, so we'll kind of give everybody a minute to get in and get settled. This morning, we are going to be talking about the aging process and then also what it looks like to be a caregiver and also taking care of yourself if you are caregiving for someone who is aging in the process. And of course, that's one thing that we all get to look forward to as humans, right? Is to that aging process. So the first speaker that I'm going to introduce this morning is Tracy Warner. Tracy has worked in several different capacities for the North Carolina Health and Human Services in her career. She currently works at Piedmont Triad Regional Council Area Agency on Aging, which is a mouthful. But she's going to talk to us a little bit about what aging looks like in kind of a stereotypical normal capacity, and then also a little bit about what it looks like when someone may have a diagnosis directly related to dementia or things like that. So, Tracy, I will hand the floor over to you. And if anybody has any questions or comments that they want to ask Tracy, you can put them in the chat. We have someone who will be your voice, or you can unmute yourself when we are transitioning to our next speaker to have an opportunity for you to ask that question out loud as well. Tracy, welcome. Thank you for being here, and I will hand the floor to you.
Thank you. Can you hear me okay, everybody?
Yes,
Okay.
ma'am.
Well, I'm delighted to be here, and I just want to take a brief moment just to explain my role within the area on aging agency. I am a regional long-term care ombudsman, and that in that role, I am an advocate for residents in long-term care facilities, and that would either be nursing home or assisted living, also known as adult care home and family care homes. And it comes out of the Older Americans Act of 1965, and it has been going ever since then. It is a free service, and our job is to advocate for residents in long-term care and try to mediate and address concerns that residents may have and make sure their rights are upheld and protected. Um, and our agency, we have 12 counties out of the 100. And so there are five of us. And so we are boots on the ground running and going in facilities. And right now, since COVID, there's just been a lot of staffing issues in facilities. And so the complaints and concerns and advocacy is at an all-time high. So I just wanted to kind of give you that backdrop. And I've had the pleasure of working with Amber and doing an agent sensitivity training with law enforcement. And that's kind of what I want to share with you a little bit today as we're talking about the aging process. And according to the National Institute on Aging, aging, as we get older, we may be slower to find words, recall names. We may have more difficulty with multitasking. We might experience a mild decrease in the ability to pay attention. Um, but despite those changes, it can still be a positive thing. As we get older, we can continue to learn new skills, form new memories, and improve our vocabulary and language. So it's not all bad as we age. There are things that we can do to protect our brain health. But some of the things that happen as we get older, I wanted to kind of talk to you a little bit about that. So, aging is continuous throughout the lifetime, from the moment that we start losing those baby teeth to the time that we get older. And as we get older, we lose our taste buds. And aging can vary in rate and degree from person to person. And let me just give you an example. Have you ever known someone that is 50 years old, but they seem like they're way older? They're not really active, they're not mobile, depending on what's going on with them medically. And then think about that 90-year-old that you might know that is still out there working in the garden, mowing the grass, and maybe even driving a car. So, aging is going to vary depending on the person and what their medical issues that they have. One thing that's important to note as we get older, it does affect our sense of independence and self-confidence. And so as we get older, we may not feel as confident driving or being out in crowds or carrying on conversations. So as we get older, we may not be able to do the things that we used to do, and that can impact us as we age. So just thinking of things as we get older that you can observe, and just as a natural process is as we get older, our muscles are going to lose mass and tone, and our spine is going to decrease. And if you're noticing that somebody is older, may appear shorter, it's actually because they are the vertebrae, the spongy cushion between the vertebrae usually flattens. And I know for myself, as I have gotten older, I used to be 5'2.5", and now I'm 5'1". So I can testify that does definitely happen as we get older. We are going to get shorter. Our skin is going to lose elasticity, and our skin is going to get thinner, and it's going to make us more susceptible to being bruised or cut. And think about that older person. They may hit their hand on the wall, and they may have a really bad bruise and it looks horrible. And we may do it. It may not have that same impact. So the skin is thinner. Some internal things that are going on as you get older, your heart weakens, arteries and veins become more rigid, our lungs are elastic, and therefore there's a decrease in maximum function, and there's less oxygen in the bloodstream. Also, our bladder muscles weaken, increasing the susceptibility to urinary tract infections. And we think about that with older uh, people, they do get urinary tract infections quite a bit. And the kidneys filter blood slower, and medications remain in the bloodstream longer as we get older. So a younger person taking medication is going to be very different for an older person. There's some changes in our senses. As we get older, the sense of smell diminishes. Our mucous membranes become thinner, and mucus structures atrophy, resulting in nasal dryness. We have loss of nerve endings at the end of our nose, and there's a decreased awareness of safety hazards. So, if I'm an older person and I put something on the stove, I go in the den to watch The Price is Right. I may not smell that something is burning. I may have forgotten that something is on the stove, and that can definitely be a safety concern for an older individual. As we get older, our changes in taste, the number of taste buds and sensitivity decreases as we get older. The sense of sweet and salty are lost first, followed by bitter and sour, which is interesting because it seems like a lot of times the older population seem to gravitate more towards sweet things, but those are the first senses that go. And our mouth produces less saliva, which makes increased choking risk. And think about that individual that's older that may be taking a lot of medications and just swallowing those medications, the hazard with that. As we get older, our hearing changes, our ear structures deteriorate, we have difficulty maintaining balance. There's a slight decline in hearing as we get older, and sharpness of hearing declines. And also, as we get older, it's more difficult. Our there's a decrease in our brain's ability to translate sounds into meaningful information. But what we don't want to do is assume that an older person can't hear. We just need to lower our pitch, enunciate our words, and keep sentences short and simple. So as we get older, there's some vision changes that we're going to experience, and our depth perception diminishes as we get older. When and how to to step down steps, our fall hazards, especially if we're in an unfamiliar area. Often we may not, as we get older, see the obstruction before we're actually on top of it and fall. Our pupils are respond slower as we get older. Headlights, There's temporary blindness from oncoming cars and exaggerated glare on shiny floors. As we get older, our eyes have more difficulty with discriminating colors. And so, one of the vision changes that an individual can have when they get older is glaucoma. And another vision change is macular degeneration. Another event that could cause problem with your vision is a stroke. And then also the yellowing of the lens. That happens to all of us as we get older, and it makes it difficult for us to discriminate against with colors. And that's why you might see an older person wearing mix match clothing. Um, and then also, if you think about pills that older people take, they're maybe on a lot of medications, and it may be very difficult for them to delineate if they have the yellowing of the lens as they're older, delineate the different colors of the pills that they're taking. Um, as we get older, we have sensation changes. There may be a reduced or changed sensation of pain, cold, heat, pressure, and touch, decreased temperature sensitivity, um, and the cause may be decreased blood flow to touch receptors, the brain or spinal cord, and or diabetes. So we, as an older person, may not feel that the water temperature is scalding and end up getting burned. And those could be definitely hazards for the older individual. Also, as we get older, we may experience arthritis in our body. Some of the cognitive changes as we get older is there is some decline in short-term memory and cognitive functions. And then the intellectual tasks may take longer to perform. But one thing that we have to note that's very important is the everyday communication skills, comprehension, and visual perception. Most language skills and intelligence do not change. So just because someone might be slower to respond or not able to perform the same task at that same rate, does not mean that they are no longer intelligent or anything like that. It's just the aging process taking longer. And we just need to allow time for that. So some of the memory disorders in aging could be delirium, which is a sudden change in mental status. Usually it's preceded by physical or emotional trauma, a disease process. It could be a medication side effect or an internal infection. Another memory disorder could be depression, which is cognitive status change preceded by loss of a person, status, property, or a medication side effect. A person suffering from depression may experience memory loss and at other times appear functioning normally. So, with dementia, it's going to affect an individual's judgment, analytical thinking, recognition of familiar people, places, ability to account for recall and time. And some of the classic characteristics are short-term memory loss, paranoia, restlessness, hallucinations, delusions, and depression. And I think that is about everything that I have. Of course, I am here for any questions, and I know that we have another speaker, so I want to allow the time for her.
Thank you, Tracy. Does anyone have any specific questions? I know this can be as you mentioned, Tracy, kind of a challenging thing to face and also a beautiful thing to face, right? Because that's just kind of part of living life and,
Yeah.
experiencing all the things that we get to experience as humans. Some challenging than other, more challenging than others, and that's okay. Um, so thank you for that knowledge base into kind of what's a natural progression of what aging looks like. So I appreciate that. And Jeannie
Thank
has just put Tracy's contact information in the chat. So if you want to connect with Tracy directly, you can do that as well. And if you have any questions, that's totally fine. You can still use the chat, and then we'll also ask for questions again at the end if you think of any specific for Tracy. We're going to transition now over to Bethany. Bethany works here at Partners. She has worked in mental health for over 15 years and is currently a part of our GAST team, which is Geriatric Adult Specialty Team, which as of July 1st will become the HEART team. And HEART stands for Health Education Aging Resource Team. Also a mouthful. But Bethany, welcome. Thank you. And the floor is yours.
Thank you so much. I just sent a request to be able to share my
Mhm.
screen. I was able to earlier. There we go. Okay. Let me pull up. So I really appreciate getting to be here with you guys this morning. And I'm going to change directions a little bit, but really very much on point to what Tracy was talking about, because as we age, we then do typically as people age, eventually everyone that ages is going to need a caregiver. So now I'm going to turn the attention to caregiving. What According to the Alzheimer's Association, right now there's 11 million caregivers, and that is just for people that are caring for people with Alzheimer's disease. So if you think about how great that number would be when you just include other types of people that need caregiving with chronic health disorders, with mental health disorders, maybe with developmental disorders. So really, caregiving, we're all caregivers at some point. And what the research is showing now is that this, what they call the sandwich generation of caregivers that are growing, that are caring for an older adult or an older adult family member, are also still have children in their home that they're caring for, which then leads to what we're going to talk about first is the symptoms of caregiver burnout. When I was working in the field and I was working a lot with caregivers, one of the things that my team would notice is that a lot of times the caregivers would get sicker than the person they were caregiving for because of that stress. So it is really important to understand those symptoms of burnout, those symptoms of, okay, I need something. So we're going to talk a little bit about what are those symptoms of the burnout? What should I be looking for? And then I'm going to spend a lot of time on what are some strategies that I can use that we can take home today to be able to address some of those symptoms of burnout that I may be noticing. Please feel free if you have questions, if you have comments, things that you see that I don't list, things that are helpful for you that I don't list, please put them in the chat or just unmute and jump in, because if any of you guys are caregivers, I would love to hear what you're noticing and then what you're able to kind of share with the team, with everybody else that's here today. So, some symptoms of caregiver burnout. The first one is denial. And denial could either be about the toll that the disease is affecting me, the fact, kind of denial about how much stress, how much I'm having to do for care for this person. And sometimes caregivers are in denial about how sick their loved one is and really what's going on. Because if we're facing what's going on, it can be really overwhelming. Another symptom is anger at the person that we're caregiving for. It's frustration. And we all kind of logically know that it's not their fault, that they're doing what they can. But when we're not sleeping, when it is taking a toll, we're not able to have the balance we need, it is very easy to get to anger and get to frustration about everything that we're having to do. Another thing that you want to look for as a caregiver is that social withdrawal. So, am I not going out with friends? Am I not doing the activities that I usually do that that give me energy, that give me the ability to keep on caregiving, that help me feel fulfilled? Another symptom of burnout that you want to look for is anxiety. Do I have anxiety about what's going to happen tomorrow? what behaviors are that is my loved one going to show tomorrow? And especially when we're caring for people that are living with dementia, that's really hard because every day can look different. So one day they can be pleasant and flexible and just really wanting to go and with the flow. And then the next day it could be like working, living, caring for someone totally different. And so that can cause anxiety, and that anxiety can grow and grow, which can turn to anger, which can turn to social withdrawal. So really looking at, am I getting anxious about what is happening? Which a lot of times after depression or with the anxiety comes depression. And depression really affects our ability to cope. It also affects our physical health. It affects stress is going to make depression worse. Depression is something that if you're noticing that feeling down, feeling hopeless for most days, for a few weeks, things are changing, your appetite's changing, your sleep is changing. Depression is one of those things that you want to make sure that you're talking to your provider about. And we're going to talk about the importance that caregivers have of when we're talking about caregiver longevity is we have to look at our own health. Exhaustion. A lot of times we're caregivers because we care, because we want to give to the people. But a lot of times a symptom of burnout is that we just can't keep doing it. We try to do and do and do and do until we just can't do anymore, which then is followed by sleeplessness. And when I used to talk with caregivers, they would be so frustrated because they would say, Bethany, I'm tired. I'm so tired. But then I lay down at nighttime and I just can't sleep. I just sleep about, think about, well, is my loved one going to wake up tonight? Or am I going to find them wandering? And tomorrow, what am I going to have to do? And they just kind of ruminate on everything and they are not sleeping, which then causes the exhaustion. And so just kind of being, again, paying attention to is your sleep being affected by your stress? Irritability, which it can be a cycle sometimes with caregiving, is I'm exhausted, I'm not sleeping, so I'm going to be irritable. The person that we're caring for is going to pick up on that irritability, which can then cause them to have behaviors, which then makes our caregiving harder. So again, sometimes they all can play together, these symptoms. Another symptom of burnout can be lack of concentration. Are you having a hard time just doing simple tasks, doing things that you need to do because of feeling exhausted, because of that stress and anxiety maybe that you're feeling? And then health problems. Eventually caregiving stress is going to take a toll on our mental and physical health. So do you notice that your own health, your own mental health is starting to decline, that you're starting to have problems that you didn't have before? So, and again, there's other signs, and it's also saying that if you have some of these, doesn't necessarily mean that you are burnt out or you need to stop or anything like that, but it's just listing those to help people be aware, that it's okay that you're having these symptoms. Sometimes there's guilt associated with, well, if I'm feeling depressed or if I'm feeling anxious or overwhelmed, that means I'm not a good caregiver or I don't love my family member. And that's just not it. It just means that you're loving, you're caring too much, and you're letting yourself pay that price. And so now you kind of know what to look for. I'm going to transition to what can we do to prevent those signs, and how do I cope with that stress? Because caring, no matter if you're caring for an older adult with chronic health conditions, that have dementia, that has mental health conditions, it is stressful and hard. And so what can we do again to be able to keep on going? So the first one is let family and friends help you communicate those needs. And I've worked with a lot of different families, and they would be like, well, Bethany, there's always, families are complicated, families are complex. And so if you're like, well, I don't have any family, I don't have any friends, it is just me. I'm going to give you some resources today as we go through some of these coping tips to look out, to reach out to those community supports as well, finding a support group, communicating your needs. Sometimes it's finding those family or friends, they may not be able to do X, but can they do Y? And just putting out those needs that you have, even if you feel like someone isn't going to maybe respond, but at least putting them out there to make sure. Which then goes to our next point, right, of seeking out caregiver support. It can be very isolating when we're taking care of people because maybe we can't go to those community events that we like to. A lot of times, people with dementia or other health conditions, the community just isn't necessarily accessible for them. And so we really want to prevent that isolation for caregivers. So finding ways to get that, finding a support network. A great place to look is in most of our partners counties, they have senior centers. So looking for caregiver support groups in your senior centers with the Alzheimer's Association, um, looking for those support groups, even at churches, like looking for places where you feel comfortable talking about what's going on. Also looking for respite services. If there's no one in your family or friends that can help you get a break, looking for some of those respite services in the community so you can get a break. And then another important kind of coping tip is journaling. And when I say journaling, a lot of times people are like, oh no, like I'm not a writer. That's not for me, which is great. Not everybody is going to journal, but it's really important that we're expressing our emotions, that we're getting them out. So I would say you can always like do voice memos on your phone just while you're driving, just getting it out. What happened? What's frustrating? Using art as a way, like I might not want to write words, but I may be able to get it out through expression. It's really just expressing your emotions and both your positive and your negative emotions. One of the most, and I'm a little bit short on time, so I'm not going to go into it a whole lot, but there's a lot of science behind the efficacy of gratitude. So again, this isn't like toxic positivity where I have to be happy, even though like, I'm so stressed and all of this chaos is happening in my life. I have to be happy because I have a house or because I can walk. No. What gratitude is saying, yes, some things are hard. There's things that are hard in my life, but I'm really grateful for X, Y, and Z. And that kind of helps shift your perspective and say, yes, things are hard, but there's some things that are going okay. And again, there's all ways to gratitude. My favorite way is when I do in persons and I give people a post-it and just write 3 things down and then post that post-it somewhere where you can see it in your car, on your phone, your bathroom mirror, wherever. So you have those reminders throughout the day. Again, it's not going to make everything easier with what's going on because caregiving is hard, but at least it's going to have some of those reminders that, yes, like this is hard, but there's some still joy or I'm still grateful for certain things. The next tip is take time for yourself, which sometimes I will do this and people will like laugh at me, like, what, and so finding those activities that you enjoy. So one of the things, if you leave today, if you're a caregiver, I don't want you to leave today without saying, how can I make this happen? Is it looking for community supports? Is it reaching out to family? Is it finding activities that I can enjoy along with the person that I'm caring for? So really being creative and finding where can I find that joy? How can I continue to be me, do the things that I love while I'm still caregiving? Because that is going to help you be able to have that longevity in caregiving. So this is an online community resources. So we talked a lot about finding those community resources. This is through the Alzheimer's Association and the AARP. So if you Google Alzheimer's Association Community Resource Finder, it will come up with this. And this is not the end all be all of community resource finding, but I would say this is a good place to start, especially if you're caring for somebody with dementia, because that can help kind of give you a place to start. Another great place is this Alzheimer's Navigator through, again, the Alzheimer's Association. It can connect you with local programs and services. It helps you identify those action steps. And it really helps you to help understand, like, where are my needs at? Where can I get support? And you can't really see it, great. It's kind of little, but there's this 24/7 hotline, helpline, and that I think we don't talk about enough because that is 24/7. There's always somebody that answers, and sometimes and they can really answer a whole wide kind of area of questions. They can answer if you have certain behaviors that you don't know how to respond to. They can help with that. If you need community resources, if you need housing tips, if you just have questions about like disease progression. So and again, there's somebody there that's going to be able to answer. So that's another great tool. So there we go. And they're also with that Alzheimer's support, there is online communities if people use online chats, and then local support groups too, they can help connect you with. And then another important part of coping with stress and these strategies is using relaxation techniques. And there's all sorts of different relaxation. And so some of these can sound like, oh my goodness, no, I don't do that. I don't visualize, right? Or I can't meditate. Like meditate's like for people that sit on the floor for 30 minutes, right? Thinking about nothing. But really, we all can do these things. Visualization, a lot of it is connecting with breath, but it's thinking in your mind, like I always say, like, go to your like calm space. Imagine going to the beach, going through your senses, taking deep breath. It's going to calm yourself down. Meditation, sometimes meditation, if you are a person of faith-based, meditation can be as easy as prayer. It can be, again, going in, connecting with that higher spiritual power, noticing your thoughts, um, breathing exercises. So when we think about stress, we have to think about it's a physical reaction in our body. So it's a cycle. So our body's going to release stress hormones. And then when we relax, it's going to release those relaxation hormones. Breathing helps trigger that vagus nerve that's going to help us calm down. So again, we could list forever. There's so many different types of breathing exercises. It doesn't have to be complicated and thinking about a shape or a number or square or whatever it is, right? Just taking a deep breath, holding it, and then letting it go. And just thinking, I'm okay, I'm safe. If you do that a few times, your body's going to release those relaxation hormones. It's not going to make everything perfect and go away, but it's going to help get you a little bit more grounded to be able to handle the stress. And then again, progressive muscle relaxation is really just kind of going through each of your muscles group, just going through your body and just trying to relax, noticing you can tense it and then let it go. So again, not every relaxation technique is going to be for everybody by any stretch, but knowing different ones. One that's not on here that I like that we don't talk a lot about is one thing that you can do if you're feeling really stressed or having a really hard day and you just really irritated or really anxious. What I used to do is encourage people would go and get like an ice pack from your freezer. And if you put it on your chest or even just hold it, because cold also triggers that relaxation response. And so sometimes you'll feel a little bit silly, like holding your, ice pack, but it's going to help bring down your system a little bit to be able to help you. Cool. I see that there's some chats. I'm just going to check in real quick and see if there's any. Okay. Oh, no. Perfect. It was just the resources. Perfect. Thank you for doing that. Okay. So again, find time for yourself, spending time doing something that you enjoy. I did this very intentionally because another important part of stress is doing something that you enjoy, but trying to get outside, trying to get your loved one outside, getting fresh air. I know right now with our weather being like it is, it's a little bit crazy to think about getting outside. You might have to go outside at like 6 o'clock in the morning or like 9, 10 at all. But for the most part, when it's not like this horrible heat wave, getting outside, getting your loved one outside that you're taking care of is important. It's going to help regulate your system. And then becoming an educated caregiver, coming to things like this, looking for Alzheimer's Association, working with your area on aging. There's so many different webinars, different information, and sometimes it can be overwhelming, but really understanding, I think the more educated we can become, the more it helps to give us a little bit more control and understanding either like disease process or even understanding like what happens when we age. Why aren't we hearing as well? Why aren't we seeing as well? And then I think this is a big one. We could talk about this for a long time, but I'm trying to move through is really trying to take care of yourself. Make sure that you are not missing your doctor's appointments. Trust me, I mean, I am a caregiver right now to just to children, and it is hard for me to schedule in my doctor's appointments, right? So I can't imagine when you're doing both. If you're caregiving for an older adult and taking care of kids. But you cannot continue to be a caregiver if you are not healthy. So really trying to make sure that you get to those doctor's appointments, using those community resources to find respite or finding a time where it works so you can talk to somebody to make sure that you are okay. And then also trying to eat well. I always tell people I'm not the cookie police. I'm surely not here to tell anyone what to eat or not to eat. However, if you think about food as fuel, that food is going to help us keep our energy. It's going to help our health is a way to kind of think about it when we're talking about caregiving. And then exercise, again, sometimes I'll talk about exercise as more as like movement. Are you moving? Is the person, if they're able to, the person that you're caregiving for, are they moving? How can you move together? How can you try to really take care of yourself in that sense? And then making sure that you're getting rest. And if you're not, then you want to talk to your provider, to the provider of the one that you're caregiving. If neither of you guys are sleeping, it's not a sustainable situation. So talking to providers about getting that support so both of y'all can get the rest that you need. And then maintaining your sense of humor. This is not about making light of the situation. It is hard. It is sad. There's grief involved. My whole like hour part of this like presentation, we talk about grief and how grief is associated with caregiving. So it's not easy, but especially with people with dementia, a lot of times they keep their sense of humor or trying to find things that make them laugh. Again, there's this exercise now called like laughing yoga. And one of the things when I do the video, one of the things that she talks about is laughter doesn't make anything go away. But if I have a problem's right here, if I can laugh, it just makes it a little bit farther away. And so finding those things, sometimes like I'll show a clip of I Love Lucy or a funny video just to make, pet video, just to make people laugh. So we understand that like this is serious, but we've got to keep our sense of humor. And I think this one is a little bit harder, especially depending on where you are in your caregiving journey. But really, and this is really kind of anybody with aging parents or us as we age, what are those legal and financial plans? It's really important and not so everybody knows, what heirloom they're going to get, but what does my loved one want as they get older? Who is going to take care of what is going to make those family systems a little bit easier to deal with if I know that I'm going to deal with the financial stuff and paying the bills, and then my family member is going to do the doctor's appointment. And then, so trying to kind of understand where everybody's going to be, how is it going to work? It may have to change. It may not be able to be the same plan forever, but to be able to start having those conversations really earlier is better so everyone can participate. And then it really provides comfort to everybody. Sometimes I'll get, well, oh, that's so depressing. I don't want to talk about that before we have to. But you got to talk about it when you can, because if you're not, then everybody's kind of confused and then we're all just kind of guessing. So again, it is finding those local resources. Sometimes like I don't even know, people will say, well, I don't even know where to start. you know, just start having those conversations, start looking up, a quick Google search can tell you like this is kind of where we need to start or how to start. And so just having those conversations too is like, what would you want when you get to this point? Are there any questions? Like I said, I went through some of those a little bit fast just because I wanted to make sure that we have time. But is there anyone, or if there's anyone that's on the call, I'm going ahead and stop sharing. But if there's anyone on the call that is a caregiver that has a tip, something that you do for stress that we didn't mention today, I would love to hear more about what you guys are doing as caregivers, if there's any caregivers on the call today.
Bethany, thank you so much for doing that. And first of all, I apologize if you said this and I missed it. But one thing, having been a caregiver in the past, that I experienced that I don't remember you saying was that I felt guilty.
Mm-hmm.
I felt guilty. Did I do the best that I could do? And
Mm-hmm.
when you have those days where it's like I just can't possibly take this task on today, I just felt I should have done that. I should have given
Mm-hmm.
given her a better bath or those kinds of things. So that was just something that I'm remembering as you're talking today.
That is I appreciate you mentioning that because I do think there's always this, but there's always that level of like, did I do enough? Is that what they really wanted? So I appreciate you mentioning that because I do think a lot of caregivers, it is really common to feel that guilt of, am I doing enough? Which if you're showing up, giving baths, worried about it, then generally you are. That's what I always tell people. If you're worried that you're like feeling guilty, then you probably are okay. But I think that's a great point. Thanks, Jeannie.
And so I was furiously Googling while you were talking and tried I hope I put the right links in. I put several of those links to the resources you mentioned. And also I put Bethany's contact information as well. So.
Yes, I appreciate that. So if y'all think of any other questions, if you need anything else, please feel free to reach out.
Thing. You're right, Tracy.
Bethany, I just was going to mention, I think too, when we talk about the guilt, I think at the point where, the caregiving is more than the individual can manage, I think there's a lot of guilt with that. And they might try to keep going on, even though it might be a detriment to themselves and the individual that they're caring for. Do you have any recommendations on those next steps of when do you know that it's at the point of beyond what you can really manage and not just keep doing it?
I think if it is starting to affect your health, if you are having health outcomes or where you feel like you can't continue, like if you truly physically can't give the care that they need, then sometimes there's steps like home health, getting an aid in, but even if that anymore isn't enough, I think sometimes sleep, if the provider's like this is just kind of their natural disease progression, there's nothing we can do to help them sleep at night and you're not sleeping at night, then I think that's something to look at. But when I worked with families, I would talk to them a lot about just because if someone does have to go in any sort of long-term care, whether it is truly like long-term care, assisted living, a family care home, that doesn't mean that then you're just done and you just have given up. What it means is it looks different, that there's other people that are doing things that maybe you can't do anymore, but you're still present, that you're still their caregiver. It's just in a different setting with hopefully ideally more support. That it's not that you're just like giving up and hands off and you're done. It just means it's just in a different way that's more sustainable for everybody, healthier for everybody. But I think that is a really good question, Tracy, as well.
I like how, you reframe that to more positive because I think so many people do, bear that burden and just reframing it to where it's more of a team approach. That doesn't mean you're no longer a caregiver. It's just, like you said, a more sustainable option where you are still going to see the individual, but you're able to manage your own health and still be a vital part of the care. For that individual.
Mm-hmm.
So that's good the way you've reframed it to help individuals see that there are other options and it doesn't mean a negative thing on the individual that is having to resort to that. I know my stepmother um my was caring for my dad who had Alzheimer's, and when he got to a point where she couldn't really, because of her own health issues, had to then rely on trying to get other options, and that's not an easy place, especially when we think about individuals that have dementia and they may just be used to one person, one caregiver, and having other people in the home can be very distressing and upsetting. I saw that a lot with my dad.
Mm-hmm.
I appreciate you both sharing that. I am the support person for a person who is caregiving for their mother who has dementia and also has
Mhm.
cancer. And I think that Bethany also mentioned a really important part towards the beginning of what you were talking about is about communication and being able to say, like, checking in with myself, yes, and taking care of myself, but also saying, look, I need help, right? Like being able to say that and to family or even external supports and using some of those community resources. Because I think a lot of times we as helpers, right, we want to be able to do it all, right? And we just can't sometimes. So being able to recognize that, but also communicate that to your support systems can be really helpful and beneficial as well.
And really looking to find those community supports. Sometimes people don't, they feel like they're truly isolated, they're truly on their own. And that is such a hard and scary place to be. So
Mm.
continuing talking to providers, if sometimes people are like, well, I don't even know where to start. Sometimes at your, either if you have like a Medicaid, Medicare, like health plan, sometimes if you have like an Advantage plan, there's a nurse case manager asking them, like asking, the person asking their primary care. So really reaching out if there's not family support, or then saying looking for that community support is really important.
Mhm. Does anybody else have any other comments or questions for Bethany or Tracy?
I just want to point out, if you're not looking at the chat, that Abigail has posted something in the chat, and I don't, Abigail, if you'd like to say more about this, but or I can just read it. She says, "Thank you so much, thank you, ladies, so much. This has been so informative, and I'd even go far enough to say relatable conversations. I absolutely could do better at listening to what I preach. I need to stop, take time, and check in with myself and find sustainability in the field of care." So, thank you for those comments.
I'll also mention that caregiving is more than just, with aging adults. Bethany mentioned her children. We all probably work in some sort of service industry with other humans. That makes us caregivers as well. Um, some of us have pets at home and don't have little people. That's a caregiving avenue too. So just know that it's more than just supporting the aging people in your life. But also one of the common themes that I think that we talked about today was really being intentional about taking care of yourself. We are continuing to age as we are also caregiving, right? So, based on what I heard Tracy express, some of those things are really natural. And also, if you're caregiving and you're not doing some of those things that Bethany mentioned, that can make that aging process a lot harder on you as well, right? So, really being intentional about taking care of our brains and our bodies, moving when we can, laughing as much as we can, crying when we need to, right? All of those things can be really, really, really beneficial for ourselves. And when you think about it, self-care is not selfish, right? We cannot pour from empty cups. So, for any sort of avenue in caregiving that you are in, I just want to encourage you to continue to take care of yourselves. And then also, please utilize some of those resources that Bethany and Tracy have given us this morning. And if you have questions or comments or you're thinking about something later, please let any of us know and we can get you in contact with whoever is the most appropriate person for that. Um, Thank you all for being here today. I'm going to pass it to Jeannie, and she's just going to give us a little commercial for what to expect next month.
Thank you very much. So, and thank you all for being here. And also thank you to our speakers. So next month, I think will be a kind of a fun topic. So it will be, our cafe will be on July 23rd. That's the fourth Wednesday of the month at 10 o'clock. And the topic is it's Social Wellness Month, and we're going to be talking about the values of social connectedness. So hope you will join. I put the registration link in the chat if you want to just go ahead and register now. You will need to choose the month to advance it to July. But I think that's everything that I have to say. And again, thank you all for being here. I hope you have a great rest of your week and stay cool if you can.
Thank you.